For many people in the UK, accessing the right care can be a challenge, especially when it comes to the NHS. With delays in treatment, the rise of private health services, and a growing willingness to pay with salary or savings, more and more Britons are taking the initiative and looking to private care to meet their needs. Our new research conducted by YouGov shows that 13% of Britons have paid for private healthcare services in the past year, with another 27% seriously considering it but ultimately deciding against it. That's a total of 2 in 5 people being either willing or have already sought out private medical care for themselves or for a loved one. It's no secret that the NHS is facing a struggle when it comes to staffing and funding, and this is leading to an increasing two-tier system that supports those with disposable income while leaving those without further behind. Dr. John Puntis of the campaign group Keep Our NHS Public explains that planing, workforce shortages, and a lack of investment is forcing those who can afford it to seek treatment from the private sector, essentially leaving the most vulnerable out in the cold. According to the survey results, a third used private healthcare for the first time, and for good reason. 53% of those surveyed made the decision relatively quickly, opting for a private clinic so they could be seen more quickly than by NHS. It's a common struggle for those who rely on the NHS, facing long wait times for a diagnosis, let alone treatment. Additionally, the majority paid for non-urgent care such as diagnostic tests or operations. For the 13% of people who did make the switch, they found themselves dipping into their disposable income or savings, or dipping into their work-funded healthcare scheme or private medical insurance, or even borrowing money from family or close friends. But, on average, those surveyed spent around £500, suggesting that private care isn't necessarily expensive, and could be an attractive alternative to those who can scrape the funds together. What's more, recent reports show that the UK government's Elective Recovery Task Force, headed by Rishi Sunak, has been giving patients greater choice when it comes to where they receive their care, with the government footing the bill. This is a welcomed move for many, implying that the private sector will be treating more NHS-funded patients. Sadly, even emergency care is leaving the NHS out of the question. Research conducted by the union Unison found that the NHS is spending at least £61 million a year on private ambulance services to respond to emergencies, a direct indication of the lack of capability from the NHS. Among ambulance services, the South Central Ambulance Service is spending the most £19 million a year, followed by the North West Ambulance Service, £15 million, and the East Midlands Ambulance Service, £9.5 million. Overall, it's hard to deny that private healthcare is becoming more and more available, and even the norm, when it comes to those seeking medical care in the UK. Those who can afford the cost can find themselves without significant wait times in the private sector and, potentially, with better care than they could receive from the NHS. Although this could lead to a more equitable system of care, it also means those without disposable income will become increasingly out of luck when it comes to accessing the right care in a timely manner.